Hello everyone.
Hello.
Hello, am I audible?
Yes, ma'am.
Yes, ma'am.
Okay, should we start without wasting our
Yes,
time
ma'am.
as we'll get only half an hour, right? Uh, I'll mute you all, okay? So only one person, या तो आप अपने आप को unmute कर लेना और I'll unmute you, okay? One of the participants, fine? Hello मनस्वी, मैंने आपको अनम्यूट किया है. हेलो. रेणुका. हेलो रेणुका.
Yes, ma'am.
ओके फाइन. आपको एक को मैंने अनम्यूट किया है, बाकी ऑल विल बी इन द म्यूट फॉर्म. ओके, आई एम स्टार्टिंग द. ओके, वो आते रहेंगे. विल ट्राई. ओके, इज स्क्रीन विजिबल? रेणुका, इज स्क्रीन विजिबल?
Yes, ma'am.
Fine. So today we'll start the water solid classification of water. All of you mute yourself, okay? Those who are coming, mute yourself. So in classification of water soluble vitamins, as we know, we have two types of water soluble vitamins. One is vitamin B complex and another is vitamin C. So in vitamin B complex, we have energy releasing and hematopoietic. Two types of vitamin B complex are there. In energy releasing, all are energy releasing vitamins. Along with the hematopoietic, मतलब they help in the synthesis of OP bases. मतलब हमारा hemoglobin बढ़ाने में काम आते हैं. They are the folic acid and the cobalamin. We'll see that in details. And the rest of the B complex vitamins, they are thiamine, riboflavin, niacin, pyridoxine, biotin, and pantothenic acid. And second water soluble vitamin is vitamin C. So we have lot many vitamins in B complex. So now we'll see. Yes, all of you mute yourself. In water soluble vitamins, as I said, we have B and C. So in today's and tomorrow's lecture, we'll see what are the functions of that particular vitamins, their effects or deficiencies, sources, properties, and RDA. Okay, so to start with, we'll see B1. What is between B1? B1 is thiamine. It is thiamine. It is thiamine. People are still coming. So thiamine, it is also known as anti-beriberi or anti-neurotic vitamin. It is water soluble. It is destroyed by high temperature and also by the alkali. So the RDA for RDA matlab recommended daily allowance for thiamine, it is around 1 to 1.5 milligrams per day, and it also depends upon our carbohydrate intake, because it acts as a coenzyme for lot many carbohydrate metabolism reactions. So जैसे diet रहेगा, accordingly levels will be there and requirement will be there. So also its requirement increases with if there is more energy expenditure, alcoholism, increased muscular activity, pregnancy, and lactation. The active form of this coenzyme is thiamine pyrophosphate. The active form of this coenzyme is thiamine pyrophosphate. This is how thiamine pyrophosphate will be formed. Thiamine, with the help of ATP in the presence of enzyme thiamine pyrophosphate transferase, it will get one phosphate molecule and it will be converted in thiamine pyrophosphate, which is also known as co-carboxylase, which is also known as co-carboxylase. Next in thiamine, it is sources from where we will get all these vitamins. Mostly the source is same for all the water soluble vitamins, since the rich source of thiamine, it is whole grains, cereals, pulses, oils, seeds, nuts, and mostly it is in the upper layer of the cereals. That is uska jo chilka rehta hai na, bran part of the cereals. Yes, mute yourself all of you. Mostly in upper layers of the cereals. And if we polish the rice, by doing that, what we are doing, we are removing the its upper layer. So in that case, 80% of thiamine will be removed. 80% of thiamine will be removed if we polish the rice. A moderate amount of thiamine it will be present in the sources like milk, egg, vegetable, pork, liver, and the kidney. So if we do this polishing, by doing that, what we are doing, we are removing almost 80% of the thiamine. इसलिए जो ये बोलते हैं ना par boiled rice जो रहता है, that is boiling of the rice with the husk, it will prevent the removal of the thiamine, but that we hardly use. So polishing rice में कुछ भी thiamine नहीं रहता है. Next, now we'll see the functions of the thiamine as a coenzyme. The main functions of these B complex vitamins are that they act as a coenzyme. So this thiamine acts as a coenzyme in decarboxylation reactions. It acts as a coenzyme in the oxidative decarboxylation reactions. All these reactions, lot many reactions we have already completed in the metabolism, in carbohydrate, proteins, and the lipid metabolism. So these are the reactions that we will see. The first is where thiamine pyrophosphate, it acts as a coenzyme, is conversion of pyruvate to acetyl CoA. If you remember this reaction, it is the multi-enzyme complex pyruvate dehydrogenase. It consists of thiamine pyrophosphate along with that niacin, flavin, all that. So it's a multi-enzyme complex. This is in which this TPP, it acts as a coenzyme, that is thiamine pyrophosphate. So PDH, that is pyruvate dehydrogenase, it requires thiamine pyrophosphate as a coenzyme. Yes, am I audible? इसको unmute किया था मैंने. Yes, you can use the chat portion if I am asking you something. Okay, Ashwini. Yes, am I audible?
Yes, ma'am.
Okay. मेरे को बता देना खुशबू जब भी कुछ प्रॉब्लम रहती है तो, ठीक है?
Okay, ma'am.
Yeah. Slide is visible, right?
Yes.
Good. So pyruvate, first example is pyruvate dehydrogenase, which needs TPP as a coenzyme. Then it is alpha ketoglutarate. Alpha ketoglutarate wala reaction, it is a reaction of the TCA cycle, where alpha ketoglutarate dehydrogenase complex, again it is a multi-enzyme complex, where one of the coenzyme is thiamine pyrophosphate along with the release of the carbon dioxide. So alpha ketoglutarate, conversion of alpha ketoglutarate into succinyl CoA. Then again, third reaction where it acts as a coenzyme is branch chain conversion of branch chain amino acids into keto acid. So the enzyme here it is alpha keto acid dehydrogenase. Lot many examples are there. ये हम जो common करते हैं in our cycle जो हम रखते हैं अपने metabolism in, these are one of those reaction. Pyruvate dehydrogenase वाला you know, alpha ketoglutarate, branch chain amino acid वाला in protein metabolism. So next is ट्रांसकीटोलेज हेक्सोज मोनोफॉस्फेट शंट एचएमपी शंट का रिएक्शन है which is ribose 5 phosphate plus xylulose 5 phosphate, it will form glyceraldehyde 3 phosphate plus pseudohaptulose, that is there. The next is thiamine pyrophosphate. It acts plays an important role in the normal functioning of the nervous system by synthesis of acetylcholine. By synthesis of acetylcholine, that is all the role of the. So all these are the coenzyme functions of the thiamine. All these are the coenzyme functions of the thiamine. So first is pyruvate dehydrogenase wala, next is alpha ketoglutarate dehydrogenase of TCA cycle. Then in protein metabolism we have branch chain amino acids, and in transketolase of HMP shunt. Then we can say thiamine pyrophosphate, it acts in the normal function of the nervous system by synthesis of the acetylcholine. So these are the functions. Now we'll see the deficiency. The yes, mute yourself. Thiamine deficiency, the disease that is related with the thiamine deficiency, it is beriberi. It is beriberi, the disease of the nervous system, and it is as I said, polished rice में 80% of the thiamine will be removed. So it is common in countries where polished rice is a staple food. अगर जहाँ पे सब rice ही खाते हैं, that also polished one, so obviously there will be deficiency of thiamine. So thiamine deficiency, the disorder that are related with the thiamine deficiency is beriberi. So fatigue, anorexia, that is loss of appetite, mental depression, peripheral neuropathy, nausea, irritability, all these are the deficiency manifestations of thiamine. So biochemical alteration that can occur because of this is, as it is a you can say coenzyme for the carbohydrate metabolism. Obviously, if there is deficiency of this, so it will lead to the impairment in the carbohydrate metabolism. Carbohydrate metabolism में भी हमने क्या देखा था? It helps in the conversion of pyruvate to acetyl CoA. Pyruvate to acetyl CoA. So if there is deficiency of thiamine, accumulation of pyruvate will be there in the tissues because pyruvate will not be converted into acetyl CoA. So pyruvate levels will be increased in the plasma and in the urine. That will be there. As pyruvate levels will increase, it will enters into the blood-brain barrier, resulting in the polyneuritis because it is not normal. And also the lack of thiamine pyrophosphate, it leads to impairment in the nerve impulse transmission. It leads to the impairment in the nerve impulse transmission. This thiamine, it helps in the increase, you can say, activity of RBCs by increasing the transketolase activity, or by we can say maintaining the transketolase activity in RBCs. If there will be decreased thiamine, it will lead to decreased transketolase activities in RBCs, and by this, by estimating this enzyme, we can estimate the thiamine deficiency. So this is the test that we use to measure the thiamine deficiency. This beriberi, as I said, it is because of the diet rich in polished, right? So it is of various types. So one is dry beriberi. Dry beriberi रहता है, another one is wet beriberi. So the name itself suggests, dry का मतलब क्या रहता है कि wet में क्या रहेगा, wet मतलब पानी पानी रहेगा, तो there will be edema, swelling रहेगा वहाँ पे. But in case of dry beriberi, only neurological manifestations will be there. Neurological symptoms will be there. That's why this dry beriberi, it is also called as a neurological beriberi. So in this dry beriberi, there will be peripheral neuritis, no edema will be there, and this dry beriberi, it leads to degeneration and demyelination of the sensory and the motor nerves. Leads to degeneration and demyelination of the sensory and the motor nerves. that leads to the wasting of the muscles, ultimately difficulty in walking, and a patient will be able to walk with the support and sit with the support. Ultimately, he'll be bedridden, and death will be there if it is untreated. If it is untreated, the death will be there. So in what happens in dry beriberi, it is the neurological manifestation that will be there, and the main there will be no edema. So neurological manifestation में क्या होता है, demyelination of the nervous system हो जाएगा, both sensory and the motor nerves, and that leads to wasting. That leads to wasting of the muscle, difficulty in walking, and bedridden, ultimately death. Next type of beriberi that is there, it is wet beriberi. So wet beriberi, here what happens in wet beriberi? It is cardiovascular type of beriberi. Dry beriberi, it is neurological type of beriberi, and wet it is cardiovascular beriberi. What happens in this cardiac beriberi? Obviously, cardiac manifestation will be there. There will be edema of legs. That's why it is called as wet beriberi. It is called as wet beriberi because edema of legs, face, and trunk will be there. That leads to breathlessness and palpitation. All cardiovascular symptoms will be there. Calf muscles swollen because of edema. BP will rise. Diastolic will decrease and systolic will elevate. मतलब ऊपर वाला बढ़ जाएगा, नीचे वाला कम हो जाएगा. And pulse will be bouncing. Heart becomes weak and death due to heart failure. और मोस्टली कैसा होता है, इट इज अ मिक्स्ड. ऐसे हमारी बॉडी को डिफरेंशिएट नहीं कर पाती ना कि अरे थायमिन डेफिशिएंसी हुई है तो अभी इसको न्यूरोलॉजिकल मैनिफेस्टेशन करना है या कार्डियोवास्कुलर मैनिफेस्टेशन करना है. दिस इज जस्ट टू अंडरस्टैंड. अदरवाइज द सिम्टम्स रहते हैं, इट इज मोस्टली ऑफ द मिक्स्ड टाइप, दैट इज मिक्स्ड beriberi is there. So we can say it is mixed beriberi. Next is infantile beriberi. The name itself suggests infantile, matlab it will be in the infants only. So this infantile beriberi will be seen in bonds born to mothers with thiamine deficiency. It will be seen in mothers born with the thiamine deficiency. The breast milk, कौन सी mothers जिनके breast milk में obviously thiamine कम रहेगा. क्यों कम रहेगा? Because mothers are deficient in that. So this symptom starts in 2 to 5 months of the life. It is sleeplessness, restlessness, tachycardia, nausea, vomiting, and ultimately convulsion, and bouts of screaming due to cardiac dilatation. Cardiac symptoms are there, and if it is very severe, it leads to death if it is not cured. Next type of syndrome, इसके ऊपर हमारी case study भी रहती है, that is called as Wernicke-Korsakoff syndrome. It is Wernicke-Korsakoff syndrome is it is called as cerebral beriberi. Wernicke-Korsakoff syndrome क्या, it is cerebral beriberi. Here alcoholism जो रहते हैं वो खाते पीते तो है नहीं, सब दारू पीते हैं, तो उसमें क्या होता है, their body demands for thiamine. There is increased demand for thiamine in alcoholics, but they don't take. So when they don't take thiamine or diet properly, so they will land into such type of syndrome, that is Wernicke-Korsakoff syndrome. So it occurs in chronic alcoholics due to dietary deficiency or impaired absorption of the thiamine So this Wernicke-Korsakoff syndrome, it leads to delirium, that is confusion, apathy, loss of memory, rhythmical to and fro movements of the eyeball, and ataxia, that is incoordinated movements. So these are the symptoms of the Wernicke-Korsakoff syndrome. It is called as cerebral beriberi, and this happens in case of chronic alcoholics. So जब भी किसी को Wernicke-Korsakoff syndrome label करना है, तो उसकी chronic alcoholism की history should be there. So that thiamine deficiency can also occur due to these two things, that is enzyme thiaminase that will destroy the thiamine, and pyrithiamine. So this thiaminase enzyme, it is present in the seafood, and this thiaminase it will act on the thiamine, it will destroy the thiamine, and it leads to the deficiency of the thiamine. So this happens mostly in the countries where the seafood is the main diet, like in Japan. So because in fish food, enzyme thiaminase is there, that will destroy the thiamine and leads to the deficiency of thiamine. Next is pyrithiamine. What is this? It is a structural analog. जैसे कि हमने देखे थे इसमें कॉम्पिटिटिव इनहिबिशन में स्ट्रक्चर एनालॉग्स लाइक दैट इट विल इनहिबिट द, it is we can say anti metabolite of thiamine which is found in the farm. It is structural analog and it is anti metabolite of thiamine, it is found in the farm. So animals like horse and cattle that consume them, they develop thiamine deficiency. They develop thiamine deficiency. Yes, mute yourself. Next, so this with this we have finished with the thiamine. In that we discuss the coenzyme functions of the thiamine. The active form of thiamine, it is thiamine pyrophosphate. Then functions, that is coenzyme actions of the thiamine. Its deficiency, which is beriberi, which is of different types, and the other things that can decrease the thiamine level, that is thiaminase and the pyrithiamine. The next vitamin that is there in the list, it is riboflavin. Riboflavin, it is vitamin B2, riboflavin. So riboflavin, it is the same as that of thiamine. It is water soluble. It is unstable at high temperature and destroyed by the alkalis. And it is also light sensitive. It is light sensitive. So don't do all these things. Okay. Otherwise, I'll stop taking the lecture. So RDA of riboflavin, it is 1.2 to 1.7 milligrams per day, and it increases in pregnancy and lactation. As, as I said, it is water soluble, unstable at high temperature, destroyed by alkalis, and it is light sensitive. Now we'll see the riboflavin. It contains the main structure of riboflavin. It contains isoalloxazine rings attached to D-ribose, attached to D-ribose. It is heat stable, but it is light sensitive. So when exposed to ultraviolet rays or sunlight, it is converted into lumiflavin, which is yellow fluorescence, which is giving you the yellow fluorescence. So when that's why it is light sensitive. When exposed to UV rays or sunlight, it is converted into lumiflavin. So that is a characteristic feature of this riboflavin. So we'll get riboflavin from the milk in the form of lactoflavin, in from the liver as hepatoflavin, and from egg as ovoflavin, and similarly other structures are there. So what is a coenzyme form for the riboflavin? The coenzyme forms or the active form of riboflavin, it is FMN and FAD. It is FMN and FAD. Riboflavin, uh, in the presence of ATP with the help of enzyme flavokinase, we will get active form of that, which is flavin mononucleotide. FMN matlab flavin mononucleotide. And by utilizing another ATP, this FMN will be converted into FAD, that is flavin adenine dinucleotide. Flavin adenine dinucleotide with the help of enzyme FAD synthase. Sources of this is milk, cheese, eggs, yeast extract, liver. Moderate sources are cereals, fruits, green vegetables. Now we'll see the functions of the riboflavin. Mostly the coenzyme functions are because of FAD. FMN participates, redox बहुत कम role है इसका, but still it is there. So redox reaction में when they participate, they will form into FADH2 or FMNH2. The mainly coenzyme functions are of FAD. So कुछ enzymes they use FMN and FAD as a coenzyme, so उनको हम बोलते हैं flavoproteins बोलते हैं. And if they use metals along with this FMN and FAD, they will called as metalloflavoproteins. Metals like iron and molybdenum, they are called as metalloflavoproteins. So FMN like NAD and all that, they act as a coenzyme in carbohydrate, protein and lipid metabolism. So it's a principal growth promoting factor of all B complex. The main growth promoting factor it is from all the vitamins, it is the B complex. So it helps in the growth, repair, development of body tissue. It keeps the skin, eyes and tongue healthy. It helps in the maintenance of mucosal, epithelial and ocular tissue. That is our skin, epithelial tissue, mucosa and our tissues of the eyes. So now we'll see what are the enzymatic reaction on which FMN and FAD act as a coenzyme. So these are the FAD requiring reactions. Long list is there. If you see in carbohydrate metabolism, it is pyruvate dehydrogenase. The same pyruvate dehydrogenase, it is the same enzyme that we see in the thiamine. In thiamine also, it is a multi-enzyme complex, so it needs TPP as a coenzyme also, as well as FAD also. So by utilizing this example, we are covering two vitamins. आगे भी देखेंगे कि और भी कोई है, but up till now, this pyruvate dehydrogenase example we can use in two vitamins. One is thiamine, where TPP is a coenzyme, and in case of flavin, riboflavin, which is FAD act as a coenzyme. So pyruvate dehydrogenase के दो part हमने देखे, दो coenzyme forms, that is FAD and thiamine pyrophosphate. So reaction is same, conversion of pyruvate to acetyl CoA. Then next is alpha ketoglutarate dehydrogenase. Again, the reaction of the PCA cycle, जो कि हमने thiamine में भी देखा. Again, it's a multi-enzyme complex, and here FAD also act as a coenzyme. Succinate dehydrogenase, again an enzyme of PCA cycle, where succinate will be converted into fumarate with the help of succinate dehydrogenase. It need FAD as a coenzyme. So another enzyme is of lipid metabolism, beta oxidation. If you remember, acyl CoA dehydrogenase. Acyl CoA dehydrogenase, it is an enzyme that will convert this acyl CoA into alpha beta unsaturated acyl CoA. So the enzyme that is there, it needs FAD as a coenzyme. 2 ATP बनाए थे हमने यहाँ पे, और 1.5 ATP बनाया था in this reaction in beta oxidation of fatty acid. Same in protein metabolism, we have glycine oxidase that will convert glycine to glyoxylate, D-amino oxidase that will convert amino acids into alpha keto acid. And in case of purine metabolism, we have formation of uric acid, which is FAD requiring step, where xanthine will be converted into uric acid with the help of enzyme xanthine oxidase. With the help of enzyme xanthine oxidase. So we have FMN requiring enzymes, that is cytochrome C reductase and L-amino acid oxidase. L-amino acid oxidase. Then we'll see the deficiency of riboflavin. We'll see the deficiency of riboflavin. So in deficiency of riboflavin, it is called as ariboflavinosis. As such, it is very uncommon कि बिल्कुल ही विटामिन नहीं है हमारी बॉडी में, क्योंकि अकेला राइबोफ्लेविन नहीं रहेगा, ऐसा नहीं रहेगा, because it is a B complex, पूरा B complex एक साथ रहेगा ये. So ariboflavinosis as such uncommon. It is along with other vitamin deficiencies. So like thiamine, chronic alcoholics, they are susceptible to B2 deficiency. Symptoms are glossitis, tongue is smooth and purple. Glossitis means हमारी tongue में usually fishes रहते हैं, it is not smooth. तो अगर B2 deficiency हो जाता है, riboflavin deficiency if it is there, it is tongue becomes smooth and purple. It is that is called as glossitis. That is called as glossitis. Then chiliosis, it is fishes at the corner of mouth. बचपन में कभी हुए होंगे, खाना नहीं खाते होंगे properly. तो लिप्स फट जाते हैं हमारे और फिशेस हो जाते हैं कॉर्नर्स ऑफ द माउथ, that is there because of riboflavin deficiency. Dermatitis, itching, skin inflammation, stomatitis, all these are symptoms of riboflavin deficiency. Loss of appetite, swollen tongue, cracked lips, eye infections, all these are riboflavin deficiency. So by activating this enzyme, कौन सा glutathione reductase, if we add FAD, that will increase the activity of glutathione reductase, and by measuring this activity of the glutathione reductase, we can estimate the riboflavin levels in our body. So this is about the vitamin B2. Third one is vitamin BC, that is niacin. Niacin, it is called as pellagra preventing factor of Goldberg. It is called as the pellagra preventing factor of the Goldberg, and it can be synthesized by the tryptophan, the enzyme that is used for the synthesis of you can say amino acid. Tryptophan is the amino acid that is used in the synthesis of niacin. So the coenzyme forms of niacin, it is NAD and NADP. Coenzyme forms of the niacin, it is NAD and NADP. Niacin is vitamin B3, which is also known as nicotinic acid. It is also known as a nicotinic acid. So it is water soluble, stable to heat, and it is fairly stable to acids and alkalis. 80 to 90% as acid loss in milling is there. RD is 15 to 20 milligrams per day, and it is related to the protein intake. Thiamine was related to the carbohydrate intake. The daily requirement depends upon the carbohydrate intake, and in case of niacin, it depends upon the protein intake. So coenzyme NAD and NADP मतलब nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate. These are the coenzyme forms of niacin. Nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate. These are the coenzyme forms of niacin. So sources of niacin, the first source is tryptophan itself. 60 milligrams, 16 milligrams of its essential amino acid. Tryptophan will synthesize 1 milligram of niacin. 60 milligram of tryptophan will synthesize 1 milligram of synthesize. But we have other functions of the tryptophan. अगर tryptophan niacin synthesize करते रहेगा तो बाकी functions कब करेगा, बाकी चीजों कब synthesize करेगा. So we are not using this function of the tryptophan. तो इसलिए हमको niacin को डाइट में लेना ही पड़ता है. Only in case of starvation, if we are not taking the diet properly, then only increased conversion of the tryptophan to niacin is there. Otherwise, both are essential in the diet, tryptophan as well as niacin. So which sources are meat, poultry food, yeast, liver, whole grain enriched breads, we can say cereals and the nuts. Moderate में milk, egg, fish and vegetarian, all protein containing foods, they contain niacin. See deficient, कि कौन से food में नहीं है, it is deficient in the corn or maize, tryptophan. Corn and maize, they are deficient in tryptophan. Still people are joining. Corn and maize, they are deficient in tryptophan. So there is history regarding this key. Actually, corn and maize, they are deficient in tryptophan. What happens? The deficiency of this niacin, it is known as pellagra. This is known for centuries. So उसने गोल्डबर्गर ने क्या किया था? What he did? उसने क्या किया? Prisoners को बोला कि they will be pardoned if they consume the diet of Plagiaris family. मतलब उनको कुछ तो भी ऐसा खाना देंगे that will be deficient in tryptophan or niacin. तो दे विल बी पार्डन. सो दे दिस गोल्डबर्गर, और उन्होंने ट्रायल लिया इन प्रिजनर्स के ऊपर. सो दे गिव देम द कॉर्न मील, कॉर्न स्टार्च, ऑल फूड डेफिशिएंट इन tryptophan. उससे क्या हुआ? दे शोड सिम्टम्स ऑफ pellagra in 6 months because they were not getting any niacin or tryptophan in their diet. They were just getting corn meal and corn starch. So they become deficient in niacin and they start developing symptoms in within 6 months. So जो प्रिजनर्स को रेगुलर डाइट दिया था तो उनको वो सब सिम्टम्स नहीं आए थे. तो इससे प्रूव हो गया कि दिस कॉर्न एंड मेज दे आर डेफिशिएंट इन द tryptophan, and this pellagra can be cured by giving the dried meat or liver to the patients. So what are the functions of the niacin? So this is very important क्योंकि almost 40 enzymes of our body of oxidoreductase dependent reaction में NAD और NADP they act as a coenzyme. NAD and NADP they act as a coenzyme almost about 40 enzymes of the class. So mainly they are obviously carbohydrate, proteins and the lipids they will be there. Carbohydrates, proteins and the fats they will be there. So NAD dependent reaction, may we have carbohydrate metabolism. See these last two examples, pyruvate dehydrogenase and alpha ketoglutarate dehydrogenase. Pyruvate dehydrogenase and alpha and alpha ketoglutarate dehydrogenase, these are the same enzyme that are using TPP and FAD as a coenzyme. So they are again the multi-enzyme complex. So एक example से we can cover 3 vitamins. One is thiamine, another one is riboflavin, then niacin. So another is glyceraldehyde 3-phosphate dehydrogenase, lactate dehydrogenase. They are NAD dependent reactions. Lactate dehydrogenase मतलब conversion of pyruvate to lactose. Glyceraldehyde 3-phosphate मतलब conversion of glyceraldehyde 3-phosphate to 3-phosphogluconate. That is there. Next is in lipid metabolism, we have beta hydroxyacyl CoA dehydrogenase, and again an enzyme of lipid beta oxidation, where beta hydroxyacyl CoA will be converted into beta ketoacyl CoA. Then beta hydroxybutyrate dehydrogenase, here beta hydroxybutyrate will be converted into acetoacetate. Acetoacetate, this enzyme was used in ketogenesis. Alcohol dehydrogenase, alcohol to aldehyde. In protein metabolism, in branch chain amino acids, it is used as the enzyme used is alpha keto acid dehydrogenase. Alpha keto acid dehydrogenase. In NADP dependent reactions, we have glucose 6-phosphate dehydrogenase and the malic enzyme. Glucose 6-phosphate dehydrogenase and the malic enzyme. Here glucose 6-phosphate will be converted into 6-phosphogluconolactone, and malic matlab conversion of malate to lactate. They are NADP dependent enzyme. NADPH dependent reaction में we have ketoacyl CoA reductase. Ketoacyl CoA reductase, it is an enzyme of beta oxidation. HMG CoA reductase, it is an enzyme of cholesterol biosynthesis. It is a rate limiting enzyme of cholesterol biosynthesis. And phenylalanine hydroxylase, it is again NADPH dependent reaction. Here phenylalanine will be converted into tyrosine. Another important is dihydrofolate reductase. Dihydrofolate reductase, here folic acid will be converted into its active form, that is tetrahydrofolate. See, by converting one of the another B complex into active form, we need niacin. So सारे B complex are important. ऐसा नहीं है कि उसकी deficiency होगी तो that will everything is correlated. So अगर niacin deficiency is there, folic acid active form we will not get, or vice versa. और जो दोनों चाहिए रहते हैं, that is glutamate dehydrogenase. It can be either NAD or it can be either NADP. It is glutamate dehydrogenase or isocitrate dehydrogenase. So deficiency of niacin. Deficiency of niacin, it is what happens? Yes, am I audible?
Yes, ma'am.
Good. Deficiency of niacin. Deficiency of niacin, it is known as pellagra. हमने फर्स्ट सेंटेंस में किया था, deficiency of niacin, it is pellagra. So pellagra, it is 3 Ds: dementia, dermatitis, diarrhea, and rarely 4 T, that is death is there. So deficiency of niacin, it is pellagra. Is dermatitis, dementia, diarrhea, and death. So it involves skin, GIT, nervous system, and absorbed in Hartnupp's, mute yourself, and it absorbed in Hartnupp's disease, which is because of the deficiency of tryptophan. Hartnup disease is because of the deficiency of tryptophan. So dermatitis कहाँ पे रहेगा? Mostly in the areas that is exposed to the sun. Diarrhea, it often contains blood with the mucus, and dementia, it is the degeneration of the nervous system. It is degeneration of the nervous system. So it is mostly seen in the patients whose staple diet is corn or maize, as it is deficient in tryptophan, and tryptophan is required for the conversion of for the formation of niacin. Leucine also inhibits the formation of NAD and NADP. So what are the therapeutic uses of niacin? So deficiency of niacin is pellagra. These are the coenzyme functions of the niacin. Lot many, almost 40 enzymes are there. We have taken important enzymes, and deficiency of it is pellagra. And therapeutic use of niacin, if it is taken into 2 to 4 grams per day, it can be used in the treatment of hyperlipidemias and hyperlipoproteinemias type 2b. So because it decreases the serum lipoprotein levels, so that it is useful in both the diseases. Also it decreases the triglyceride synthesis in the liver. Also it decreases the circulatory, because it inhibits the lipolysis in the adipose tissue. That's why it will decrease the circulatory free fatty acid. That's why it will decrease the circulatory free fatty acid. So therapeutic use of niacin is also there. So this is all about the niacin. So up till now we have finished the thiamine, riboflavin, and the niacin. Now we'll see another vitamin, that is pantothenic acid. That is pantothenic acid. It is vitamin B5. Pantothenic acid is vitamin B5. Pentose, it means it is present everywhere. It is known as chick antidermatitis factor. It is known as chick antidermatitis factor, filtrate factor बोलते हैं उसको. There are two active forms of this vitamin, that is coenzyme A and acyl carrier protein. Coenzyme A and acyl carrier protein, ACP बोलते हैं उसको. So coenzyme A की the compounds that will bound to pantothenic acid or coenzyme A, it is acetyl-CoA, succinyl-CoA, and acyl-CoA. So these are very useful products. Acetyl-CoA, it is the main integrating component of all the metabolisms. So the compounds that bound to pantothenic acid is acetyl-CoA, succinyl-CoA, or acyl-CoA. So sources, as name itself suggests, panto means everywhere. So it is present in the everywhere, or in plants and animals, in egg, liver, meat, yeast, and all vegetables. And RDA for that is 5 to 10 milligram. Deficiency is not reported. Still, burning fit syndrome of Gopalians is there with the deficiency of this pantothenic acid is reported. It is also called as Grierson's Gopalian syndrome, but hardly any deficiency is there because it is present widely distributed. So functions of this will be exerted through the coenzyme A. If you remember, almost सारे metabolism में हम coenzyme A use करते हैं. Again, PDH and alpha ketoglutarate dehydrogenase. Again, multi-enzyme complex. Coenzyme is needed. So the conversion of pyruvate to acetyl-CoA आ गया. Acetyl-CoA, it integrates all metabolic pathways. Next is alpha ketoglutarate to succinyl-CoA, and this succinyl-CoA is required for the synthesis of heme. नेक्स्ट हमने फैटी एसिड बीटा ऑक्सीडेशन शुरू करने से पहले वी एक्टिवेटेड द फैटी एसिड by introducing CoA, that is we form this acyl CoA from the fatty acid. Again, it is a carrier of a activated group. Then formation of acetylcholine, we need this CoA. Acetyl CoA plus oxaloacetate, the reaction is citrate will be formed and CoA will be released. Also it helps in the cholesterol and ketone body synthesis. सब में acetyl को लगता ही है. And it also regarded, that's why it is regarded as a coenzyme of metabolic integration, since acetyl CoA is the central molecule. So this is about the pantothenic acid. Very easy. कुछ उसकी deficiency नहीं है because it is present everywhere. Coenzyme A जहाँ जहाँ लगता है, all these are the functions of the pantothenic acid. So lot many reactions are there. Few examples I have taken. The next is the pyridoxine. Next is pyridoxine, as I think so. You want me to continue? We'll finish this vitamin, then we'll stop. Next is vitamin B6, that is pyridoxine. Pyridoxine is present in the three forms. Pyridoxine, which is alcohol form, pyridoxylaldehyde form, and pyridoxamine, it is amine form. So pyridoxine can be converted into aldehyde and the amine form, but aldehyde and amine form, they are not interconvertible. So the active form of the pyridoxine is PLP, that is pyridoxyl phosphate. Again, you have used this vitamin in the as a coenzyme in lot many reactions. So it is water soluble, it is reasonably heat soluble, sensitive to high temperature, oxygen milling and processing. RDA, it is 2 to 2.2 milligrams per day. Sources, rich sources are meat, milk, egg, fish. Good sources are yeast, etc., tubers, roots. अच्छा खाएंगे तो you will get all vitamins. Function, the main role of pyridoxyl phosphate, it is in the transamination reaction. Are SGUT and SGPT, that is AST and ALT, they use. PLP, mute yourself, AST and ALT as a coenzyme in transamination reaction. So amino acid plus keto acid in the presence of enzyme transaminase, which use PLP coenzyme, it will form keto acid and amino acid, and that amino acid will enters into TCA cycle to form the carbon dioxide and water. So it integrates all carbohydrate and protein metabolisms. Next is the decarboxylation reaction. Most of the decarboxylation reaction with the help of enzyme decarboxylase, we can form the lot many biologically important components by decarboxylating the components by using PLP as a coenzyme, like tryptophan. If we remove the carbon dioxide from the tryptophan, we will form serotonin, which is also known as 5-hydroxytryptamine. It is called as a neurotransmitter. It is called as a neurotransmitter. Next is histidine. If we remove carbon dioxide with the help of again PLP and decarboxylase enzyme, we will form histamine, which is having inflammatory and allergic action. Glutamate, again an inhibitory neurotransmitter, it will form GABA, aminobutyric acid. Tyrosine to catecholamines like dopamine, norepinephrine, epinephrine, they can be formed by the decarboxylation reactions. Heme biosynthesis, ALA synthase enzyme will use this delta aminolevulinic acid, uses the PLP as a coenzyme. Then glycogenolysis, breakdown of glycogen into glucose 1-phosphate, it will the glycogen phosphorylase will use this you can say PLP as a coenzyme. Then transfer of sulfur, metabolism of sulfur containing amino acid, homocysteine plus serine. It will form cysteine, and with cysteine by decarboxylation reaction, it will form taurine. Deamination of OH group from the OH group containing amino acids, serine and threonine, they will form the respective they will form the respective keto acid, that is pyruvate and the alpha ketoglutarate, and then they will enter into the TCA cycle. Then next is glycine to serine. By this hydroxymethyl transferase, we will use PLP as a coenzyme by removing the carbon dioxide. So deficiency of B6, mainly it is the neurological symptoms that are there due to decreased synthesis, as lot many neurotransmitters are synthesized from with the help of this B6 as a coenzyme. So deficiency of it leads to the neurological symptoms due to decreased synthesis of amines, that is serotonin and GABA, like GABA, norepinephrine and epinephrine. So that leads to neurological symptoms like depression, irritability, nervousness and confusion. Tiredness and fatigue will be there. Convulsion and peripheral neuropathy can be there if the deficiency is severe. Anemia, as it is used in the heme metabolism by ALA synthase enzyme. Infants, if there is decreased neurotransmitters, so it also leads to neurological manifestation in the infants also. And infants may suffer from the convulsion if deficiency is severe. Decreased immune production, if it is there, it leads to anemia, that is hypochromic microcytic anemia. That's why we took this as a in a hematopoietic vitamin. So as we said, synthesis of niacin from tryptophan is there, that is there, but the synthesis of niacin from tryptophan, it requires PLP. Again, all vitamins metabolism, they are interrelated. So synthesis of niacin from tryptophan is there, but that also only in the presence of vitamin B6. So if there is B6 deficiency, niacin formation will not be there, and tryptophan will form this sense urinic acid, and in deficiency of B6, sense urinic acid will be excreted in the urine, and by estimating this sense urinic acid by giving tryptophan load, we can estimate the B6 deficiency. We can estimate the B6 deficiency. So dietary deficiency is there, still it is there. If in the alcoholics में हर तरह के deficiency हो सकती है because they don't take their diet properly, and in the women taking oral contraceptives, and in the infants. So toxicity, if it is there, water soluble vitamins की toxicity usually होती नहीं है because they are excreted in the urine. If it is there, it leads to convulsion and the neuropathy. And the therapeutic use of it is in the convulsions, that in the seizures, in the Down syndrome, and in the premenstrual syndrome. In the premenstrual syndrome, that is there. Also, INH, if patient is on the anti-TB drug, so along with that anti-TB drug, patient should be administered with the B6 pyridoxal, because INH drugs which are used for the treatment of tuberculosis, it will combine with the PLP to form an inactive hydrogen. So it leads to the deficiency of the B6. So long-term deficiency leads to peripheral neuropathy, and patient responds to B6 therapy. Same is with the, if the patient is taking penicillamine, it is used in the treatment arthritis, Wilson disease, and the cystinuria. These drugs also interact with the PLP to form the inactive thiazolidine. So administration of these drugs should be supplemented with the pyridoxine supplementation. So this is all about today's lecture. Okay. You have any problem? You can ask me if you have any problem. Any doubts?
No, ma'am.
No? Should we stop here? We'll finish rest of the vitamins tomorrow at 1:30. You will get the invitations. Okay? I think this much is sufficient for today's lecture. Okay? Okay then, bye.
Yes.